With that, we shift our attention to what we just teased. AI is also beginning to reshape healthcare, especially in early disease detection. One area drawing attention is breast cancer screening. AI-led thermal imaging and data-driven analysis is helping identify risks earlier and potentially expand access beyond larger urban hospitals too. Now, the focus is on faster diagnosis, wider reach, and reducing gaps in preventive care. To talk about how this really works on ground, we're joined by Dr. Geetha Manjunath, founder, CEO and CTO of NIRAMAI Health Analutix. Thank you, Geetha ji, for being with us on the broadcast. And, we've been tracking your story, the wonderful journey of NIRAMAI the last so many years. You've built an AI system that can detect breast cancer without touch, without radiation, without any pain. And we've seen this technology now, Indians having access to it. How exactly does it work though? Tell us the science behind it.
Yeah, thanks for that question. Yes, at NIRAMAI, we have built a new method of detecting breast cancer. We just measure the temperature variations on the chest and convert that into a breast health report automatically. For this, we actually use an infrared imaging device, which basically is like a photography session. Just like a passport photograph, the device is placed 3 feet from the person and the lady is sitting 2.5 feet from her, and just like you would take a passport photograph, of course we have to remove clothes, but nobody sees you. It's like a changing booth. The lady enters, closes all doors and curtains, and then she sits inside. She's alone. No one sees her when she's not wearing clothes. And then she sits in front of this device. And a click, 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 5 views are taken: frontal, left 45, left 90, right 45, right 90. And that's about it. These 5 thermal scans are uploaded to our tool, which automatically extracts detailed, what we call as radiomics or biomarkers, which are minute temperature patterns, which may signify abnormalities. And also vascular issues, that is, some areas are getting more blood flow than the other areas and so on. So about 121 different patterns are sort of looked for, and if those or a combination of those are available, then we flag the person as likely malignant or suspicious for malignancy.
Okay, Professor Manjunath, what you're telling us is interesting. Cancer changes temperature and AI can detect that, you're saying. At what stage can it be detected using this tech? Is it very early on?
Yeah, very, very early on. In fact, because when there is a cancer cell, few cells, which become little erratic and they start multiplying at a much larger rate, that's when we call cancer, and that's when the temperature at that area is higher because there's higher metabolism and there's nitrogen oxide generated, and because of that, that specific area becomes little higher temperature. But everything that is high temperature is not cancer. So we need to figure out if any of the high temperature areas are looking like an irregular multiplication. So we have a concept of hotspot, just like a concept of lump is there in an X-ray based test or a hand-based examination. Instead of lump, we use the word hotspot because it's a thermal increase, right? And once we get a hotspot, we analyze the structure and boundary conditions and characteristics of this hotspot to see, is it a regular, simple tissue which is just doing its job, or is it abnormal? So there are about 117 parameters of the hotspot itself we extract, which really helps us in determining whether it falls in the malignancy or likely malignancy category or completely normal. So this is one, and that is where we use machine learning. Because if I call out everything that is
correct. Geetha ji, tell us also a little bit about affordability and accessibility. You've given us a list of pros, but is tech also addressing India's wide urban-rural healthcare gap? And to what extent?
Absolutely. In fact, this is the reason why we started NIRAMAI, right? Really, there is a huge, what I call as healthcare divide between the urban and rural areas, developing and developed countries, and also within an urban area, the haves and the have-nots, right? AI can really bridge this gap, and our test is an example of how we do this, right? For example, because our test is very portable, we can take it out and do the screening anywhere in rural India. And not only that, it is very lightweight. We can put it in a backpack, take it out, and set it up in any place. So, for example, we have outreach programs. First of all, in corporates, right? For example, Google, Microsoft, Accenture, Make My Trip. Several of the companies have offered our test in a conference room, for example, inside their own offices, just the ladies spending 10 to 15 minutes. So this is in the urban setting, because even urban ladies are not coming to get a screening done.
Yeah.
In the rural, of course, it's amazing how simple health workers are able to use our tools to screen women. So, for example, we go to a primary healthcare center. We've set it up in multiple primary healthcare centers, district hospitals. We have 30 plus vans in India where we inside the van itself we create a privacy booth so that no one sees or touches the person when the screening is done, and the van actually goes to even corners like slums of India and request the lady to come in and take the test. So most importantly, right, in these rural areas there is no doctor. Because the tools are completely automated, we can actually train a simple health worker who is just like 12th class pass to start using it. So because of that, it really helps to bridge the gap. We just figure out red, yellow, green, and when there is a red, the lady is put on a list of patients requiring follow-up, and then the local health authority basically ensures that there is a follow-up diagnostic workup done.
And I hope that
so
follow-up
it's really
is happening.
bridging the gap that you asked for.
Yeah.
And this is a perfect example of how it can help.
Because the story will remain incomplete if there's no help at the end of the road, right? So if there is a warning sign and you're not being able to act on it, that's a worry in itself. So I hope that that is being addressed as we speak. Professor Manjunath, do you see AI expanding into detecting other diseases early on as well? So let's shift our focus for the next few seconds away from just breast cancer screening and your innovation, and what your expectations are when it comes to other diseases and their detection.
Yeah, so it's a great question. There are several such companies and startups who have developed AI-based techniques for many diseases. For example, yesterday I was with Anand, who is the CEO and founder of Remedio, who's used AI for detecting several of the eye abnormalities. Forest, for example, does a similar thing for even figuring out if somebody needs to wear specs or not, right? Because when you go to the rural areas, even eye care becomes really, really important, right? So that's one. And then lung cancer, how do we analyze chest x-rays to figure out whether there's early lung cancer? And we developed the similar one for COVID screening example, right? So there are several AI-based medical imaging startups who have come forward. Oral cancer, cervical cancer, we do see several regulatory cleared, clinically validated tests that are available from India, made for India, and ruling the world almost.
Okay. Geetha ji, I do have a follow-up, but before that, I do want to ask you about any stories of success around your innovation that has stayed with you. Would you want to share something with us here on the Breakfast Club?
Yeah, definitely. I remember once, I was driving and there was a call from the head of Karnataka Cancer Society, Mr. Suresh sir. It was early on, like 3-4 years into the technology, and we were actually doing a lot of camps. And Karnataka Cancer Society has been doing, a lot of screening camps for cancer, as you could imagine. So he called me and said, "Geetha, what have you done?" I said, "Like, what happened, sir?" I got very nervous. Then he said, "I have been doing cancer screening for 50 years, as a company, as a society. Every time I use the word cancer, people run away. And now I'm sitting in front of your device in the camp, and people are saying, I want to go first, I want to go first. Don't close it before I do it." Listen, there's a line of women who are fighting to get your test first. I've never ever seen this. And that, is an amazing story I will always remember, because the reason this happened is because it's instantaneous reporting. It is completely no touch, no see, no pray. And it's like a changing room experience. So if we can work on the experience of doing the screening and providing the result, almost correct result immediately, there's a lot of tension that relieves and people really want to do, really want to use, right? Today, India has 1.3% as screening rate, right, with the mammography ultrasound. If we can enable more number of women to actually take tests by making use of such tools, right, we can really stop so many cancers or cancer deaths. Definitely we can stop with early detection.
And the wonderful part to the story is that AI in healthcare in India is also, as is the case in the rest of the world, moving now from prevention to also treatment. So we have all of it covered, all under AI in healthcare. Geetha ji, very quickly before we let you go, do you then think, can India lead the world in AI-driven healthcare innovation in a few years from now? Or are we far, far away? There's time to get to that point.
With all honesty.
Yeah, I'm really optimistic actually. Definitely, India can be one of the leaders showing how AI can be used, particularly in the impact category. Because India has a lot of problems around. We have excellent, brilliant minds, young engineers, young scientists, young doctors who are turning to entrepreneurs as well, right? And we are all looking at problems which are very dear to us and we want to solve it with this, right? With that and the huge population where we can actually fine tune our data to have better results, I think we can definitely be a role model to other countries and definitely a leader in how AI can be used for impact, how we can use AI to bridge the healthcare divide that we talked about. Definitely, I think we will definitely be one of the top 3 in doing this.
Professor Manjunath, thank you so much. It was lovely connecting with you, and thank you for breaking down the story around NIRAMAI and the wonderful work you've been doing for the last so many years. Thank you.